Welcome to Prime Physio Diploma. This brief introduction is aiming to explain the main objectives and structure of this program, and also to explain to you the distance learning block or distance learning element of this program. So the aim of this program is to help you to develop a range of practical and clinical reasoning skills, to help you to simplify different concepts related to manual therapy practice, and also to encourage you as a clinicians to understand different topics related to self-development, this including understanding research, critiquing research, and also demonstrating your understandings of the different concepts that will be taught during the teaching block, and help you to demonstrate these skills in a way that could be evaluated and by the examiners, and also to give you a feedback in order to further develop your skills. So this program is divided into three sections. The first section is the face-to-face teaching. The second section is distance learning. And the third section is your self-managed time. Your self-managed time is very important part of this program because it will help you to further develop your knowledge and skills. The distance learning program is just a framework to help you to use your self-managed time in order to produce a task, or to solve or to do a task that will be assessed, and the mark of this task will contribute toward the final mark of the program. And the final component is the face-to-face teaching, which is based on 3 teaching blocks spread over 4 months. So the distance learning is actually split into 4 tasks. These tasks will be delivered over 4 months. All the tasks to be submitted by 1st of September 2015, except task number 3 and task number 4 that will be submitted on during the final teaching block. For the face-to-face program, it consists of 3 teaching blocks. Teaching block 1, this will be delivered by Dr. Simon O'Shea. He's an associate lecturer at Sheffield Hallam University in the United Kingdom. Simon is a certified manual therapist with the British Manual Therapy Association. He also worked as an extended scope practitioner within the NHS in the UK, or National Health Service. The main objectives of this teaching program is to introduce a simplified logical approach for management of lumbar spine, sacroiliac joint, hip, and knee joints. During this teaching program, teaching block, you will be exposed to a very wide range of assessment and treatment strategies. The course is very practical and very hands-on, but also it will include a good range of case studies to challenge your clinical reasoning skills. Teaching block 2, this will be delivered by Dr. Mahmoud Saad. He's a senior lecturer at Sheffield Hallam University and manual therapist. He's a certified McKinsey therapist and fellow of the Higher Education Academy in the United Kingdom. Mahmoud also worked as a musculoskeletal clinical specialist in private practice in UK. The main objectives of this teaching block is to introduce simplified logical approach for management of cervical spine, shoulder, and elbow joints. Again, wide range of assessment and treatment strategies will be delivered, and wide range of case studies, either paper or real patients, will be used in order to challenge your clinical reasoning skills. For teaching block 3, basically this will be a revision of all the techniques that has been delivered on teaching block 1 and 2. In addition, more in-depth discussion of different concepts like neurodynamics, core stability, advanced exercise and rehabilitation program will be demonstrated. This block will be a very good opportunity for you to consolidate your clinical reasoning, and also it will be a preparation for the final exam. In order to pass this manual therapy program, you have to achieve a total of 60 marks out of 100. The 100 mark is split over 3 sections. The first section is MCQ exam, multiple choice questions, and this will be at the end of teaching block 3. You will have 50 questions. Each question will have 1 mark, and the total time for the multiple choice question exam is 1 hour and 20 minutes. You have 4 tasks, distance learning tasks, over the total time or the total period of the program. Each task will be marked with 5 marks. So the total mark for the distance learning tasks are 20 marks. Practical exam, which will be at the end of teaching block 3, this will be 30 marks. In order to pass again, you have to achieve 60 marks out of 100. Unfortunately, if you didn't manage to get 60 marks out of 100, you have another chance to retake the exam in any other country or in Kuwait on the next diploma intake. If you pass the diploma and achieve 60 marks out of 100 or over, you will get a certificate of achievement, which means that you have managed to achieve the main objectives of the program, and you are a manual therapy diploma holder. If you didn't manage to get 60 out of 100, you'll be given an attendance certificate, but unfortunately you will not be given the diploma certificate. Now, preparation. To prepare for this very intense program, we advise you to revise your anatomy and biomechanics of different joints of the body and the spine. To read the PowerPoint that will be in Facebook group titled How to Read the Research, How to Critique Research. Make sure you come prepared with comfortable clothes for the practical techniques. You might also need to enroll to the Facebook group, which will be the main mean of communication between the Prime Physio team and the participants. You also need to send an email to primephysio@primephysio.com. In this email, you have to state, you have to write your full name as you would like it to appear in your certificate, and also you need to send us a contact number just in case if we need to get in touch with you at any time. Please, during the 4 months of the program, make sure to check your email and Facebook group wall on a regular basis. Okay, by reading the 2 PowerPoints, how to read a research and how to critique research, you already started your distance learning. You will receive a package of documents that include all the information about the 4 tasks. Task 1 is how to read, how to critique a research. Basically, on this task, you will read these 2 PowerPoints, which are very self-explanatory, and you have to read a couple of studies, and you have to apply your knowledge or your understanding of the information on the PowerPoint on these 2 studies. On task 2, we will introduce a very popular type of research method, which is randomized controlled trial, or RCT. You will be asked to use a quality assessment score, which is called Pedro scale or Pedro score, in order to assess the quality of this RCT. Tasks 3 and task 4, basically they are 2 case studies, lumbar spine and cervical spine. You have to read these paper case study, and you have to prepare a PowerPoint presentation, and you have to take a video of yourself or your group assessing and treating a model to show us your handling skills. Finally, we would like to give you tips for success in this program. Make sure you book time in your diary. We're all busy. We all have family commitment and work commitment. Make sure you book at least 3 hours every week, 2 to 3 hours every week to do your work, to do your reading or to do the task. Make sure you communicate with your colleagues in this diploma. In this program, we have a wide variety of expertise, people coming with different years of experience, people coming from different clinical setting. So it will be very important to communicate with your colleagues because we always learn from each other. Finally, if you are in doubt, please ask. We're always there to help you. The main coordinator of the program in Kuwait is Dr. Wael Ahmed. You can ring him if you are in doubt, or you can email primephysio@primephysio.com if you have any question, and we always aim to get back to you within 48 hours. Hopefully you will enjoy this program, and the teaching team is looking forward to see you on May 2015. Thank you.